The cost of living is increasing almost everywhere we look. Rent, gas, electric, groceries. We learned recently insurance carriers are the latest to request a double-digit rate increase after getting one approved by state regulators just last year. So what's behind this most recent request, and is it likely to go through? Senator Tony Hwang is ranking member on insurance and real estate. Good to see you, Senator.
Great to see you, Mike.
Welcome back. All right, so inflation is a little over 4% right now. It's pretty high. How do insurance companies justify a double-digit rate request?
In over 15 years, I have seen rates increase every single year. And to the consumer, it's a gut punch and a deja vu all over again.
Right.
We've never seen it decrease. But ultimately, I think people need to fully understand the cost of health care is excessively high. And the ecosystem is full of components that is hard to control, from prescription drugs to hospitals to medical providers to our insurers to the entire ecosystem.
Right.
Most consumers don't fully understand the full cost.
They don't understand it because it's opaque.
It's intentional.
It is. So if I go to the doctors and say, your code for this service was this, and I say, what was the code? What's that code mean? They're like,
Not a clue.
Right. The people were like, if I go to write the check, so if it's opaque in every step, how do you fix that as a lawmaker?
Well, one of the things that we did was to create a kind of a compelling audit of costs from all the medical providers, hospitals, and procedures. That was a bipartisan passage to try to be able to get some collection of data. Mm-hmm. Unfortunately, data has been restrictive, selective. But ultimately, one example of the egregious opaqueness is urgent care centers that have been sprouting up all over in our community,
We've seen them,
providing easy access, convenience, but they're considered emergency room visits. And they're billed and insured as
like
such.
Like an emergency room visit.
Right? The other aspect is prescription drug concerns in regards, how does this country that formulates innovation and research and development have the highest cost when Canada and other countries have the same drug at a lower cost? And our hospitals in regards to how they do.
Is that all lobbyists? Is that all, what is it?
The power structure, the opaqueness, but these players are integral partners in our system. Hospitals are the largest employers. Science and research and development for our biotech sectors, huge innovation, competitive advantages.
So is the worry that if you try to regulate them too much that jobs will disappear? Is that what's in the balance there? Like, what's the concern?
The entire ecosystem needs to be reevaluated. But another factor is our Medicaid structure.
Right.
The Medicaid reimbursement is one of the lowest in the country in Connecticut. But unfortunately, it's also played into the system where subsidization of the Medicaid marketplace to the private payer marketplace has kind of flowed into impacting cost. We're offsetting the fully insured marketplace and independent businesses and contractors to subsidize, in my opinion, Medicaid shortfalls that are happening.
So if Medicaid,
the entire ecosystem is broken.
If a doctor treats a patient who can't afford, they're dying on the table, and a doctor takes an oath to treat a patient and they can't afford to pay, Medicaid is supposed to pick up the tab. The reimbursement that comes from the state is among the lowest in the country, so the doctor goes, I'm going to get paid 20 cents on the dollar for saving a life. And that's the rub, I guess.
That is. There's a marketplace impact. Healthcare economics does not apply to real life circumstances, right? When you have loved ones that are impacted by health decisions, cost is not a factor, but ultimately it is a consequential impact. I think the thing that gets lost in the continual cost is when you try to manage costs, when you try to put a kind of a litmus test in regards to where costs from and where you deduct it, you're going to get resistance from every part of the ecosystem. We've seen that. There was a bipartisan focus, Mike, from Democrats, Republicans, and the administration to reduce healthcare costs. We've run into roadblocks of how these kind of changes, how these kind of concerns and being able to manage costs.
So what do ratepayers do if all of a sudden you're on a fixed income and your insurance goes way up, whether it's Medicaid or Medicare or you're just normal carrier? Is there a way, and ratepayers can be counted and say, look, I'm against this, I want to have my voice heard? How does that happen?
I think one of the biggest points that we've had, and there's political consequences in regards to philosophy. For example, the Democratic majority believes strongly of a single-payer system.
Right.
The public option concerns.
Right.
For us in the marketplace, being the insurance capital of the world, I believe that we should utilize the talent and the actuarial experience of our insurers to be able to compete and meet the marketplace needs of small and individual people who use insurance. That is called the Association Health Plan.
Right.
That's been bipartisanly supported by over 50 industry marketplaces.
I got 20 seconds. Do you see that coming up again in the next session?
No, because the majority sees the public option as a solution, and the Association Health Plan has never, ever seen the finish line because there's a focus on pushing for the public option.
We got to have you back on the Face More Facts podcast so we can talk about this for a little longer. Good to see you, Sam.